Welcome to Robert Wood Johnson University Hospital Somerset's Health Talk. On today's show, we will discuss the link between obesity and COVID-19 and the strategies for losing weight, including weight loss surgery. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group's Warren Internal Medicine. Nearly 42% of Americans are obese, according to the Centers for Disease Control and Prevention. Obesity increases your risk for many serious health conditions, including heart disease, diabetes, and stroke. It also puts you at increased risk for COVID-19. We are joined today by our special guests, Dr. David Ward, a bariatric surgeon at Robert Wood Johnson University Hospital, Somerset, and RWJBarnabas Health's Medical Group's Somerset Bariatric and Metabolic Center, and Sandra Calado, a registered nurse who is the coordinator of Robert Wood Johnson University Hospital, Somerset's bariatric surgery program. In accordance with social distancing due to the COVID-19 pandemic, our guests will be joining us remotely via teleconferencing. Thank you both for being here. And first, for the audience itself, Dr. Ward, do you want to tell us a little bit about yourself, your background, and what got you interested in bariatric surgery?
Sure. I've been practicing weight loss surgery for 21 years now. My interest started during my medical school when I was at Robert Wood Johnson in New Brunswick. And Dr. Robert Brolin was my advisor. He was one of the leaders in weight loss surgery throughout the 1980s and 1990s. And when I worked with him and his patients, I got interested in weight loss surgery, and especially with the advent of laparoscopy and minimally invasive surgery, that was a huge benefit for obese patients, because many of the patients who were having surgeries had a lot of complications with open surgery. And in that late 1990s, there was a big advancement in weight loss surgery with new instrumentation, and I was involved in that. And that's when my interest really rose. Because of that change, so many more patients would be willing to undergo surgery. And since the late 90s, early 2000s, the growth of weight loss surgery has been really exponential, especially in the early 2000s when laparoscopy really took off with weight loss surgery. And that's really drove my interest.
And Sandra, you want to tell us a little bit about your background and what got you interested in being the clinical coordinator at the Bariatric Center at Robert Wood Johnson University Hospital, Somerset?
Yes, I've been a registered nurse for 22 years. I have been involved in general surgery with a focus in bariatric surgery for the past 12 of those years. And I became interested in it when I was employed on a bariatric surgical floor because of all of the exciting changes and opportunities that patients have once they have their weight loss surgery done. It's an excellent tool for gaining and maintaining a healthy weight.
Well, thank you both for what you do. And Dr. Ward, I've had so many patients who've done so great with what you've done. I'm thrilled with the work that you do. So during this COVID-19 pandemic, unfortunately, a lot of people have put on the COVID-19 while they've been home. And individuals who are obese are at an increased risk of getting the virus and also increased of severity of the illnesses that they have due to the obesity. Dr. Ward, can you share some information about it, about obese patients, the risk of hospitalizations, et cetera?
With COVID-19, it's mainly a respiratory illness. And when you're obese, first thing is it's harder to breathe just when you're not sick, just because of having all that extra weight. It reduces the capacity of your lungs because all that fat's pushing up on your chest. And so when you take a deep breath, you use more energy, more work to do that. And imagine when now you have a disease that affects your lungs, that makes it much harder for your lungs to function. And also a lot of obese people actually have type 2 diabetes undiagnosed. And somehow that's also a big factor that when they show up at the hospital with the illness, their sugars are out of control, and that puts them at more risk for complications of the illness. So when you look every night on TV when they're showing the people who have expired due to COVID, you'll always notice that they're usually heavy. Even the young people in the 30s and 40s, they tended to be the obese patients, most likely with type 2 diabetes. So there's definitely underlying cause of their death. It has to do with, all the problems that are associated with obesity. Being heavy carries a lot of other risk factors. And as you know, as an internal medicine doctor, you see that all the time in your practice. Same as I do. Patients come in and even when their weight is elevated, they don't even know they have diabetes. Once they start getting tested, they have sleep apnea, diabetes, and those are all factors that affect respiratory illnesses. And we've been seeing that with this pandemic, when just so many people are getting ill.
And with your bariatric surgery, what is wonderful is that those people who do have diabetes, elevated blood pressures that are hard to control, and in fact, diabetes where they're taking insulin, I've sent them over to you, you've done the bariatric surgery, and the diabetes has come under control, sometimes having people taken off of medications. Same thing with blood pressure medications, and their BMIs, which are in the 40s, are down to 25 to 30.
Yeah, if you just lose 50 pounds, that's a huge factor in your blood pressure control and all your comorbidities. And that's the thing with our patients, is that I always tell them, even if you just get half the weight that you have excess off, you're going to notice a huge change in your health. And with the pandemic, it's really been more of I would say, patients are much more aware that being heavy is a big problem. Now more than ever, we're seeing it in terms of more sedentary people are, the more weight they're putting on. And then once again, they're not really doing much. And then when they start doing things, then they realize, wow, my back hurts, my knees hurt, I don't feel as good. And that's all due to the obesity. So the great thing about a weight loss surgery is you're actually treating and curing the problems. You're not just giving a medicine to help, palliate the problem. You're actually resolving problems. You resolve back pain, knee pain, you resolve the diabetes, you resolve sleep apnea, hypertension. So as opposed to just keep giving medications, this really helps.
Well, what you're doing is you're helping the source or the etiology of the disease itself, not the symptoms, as you had said. And if we can fix the etiology of diabetes, high blood pressure, especially in the COVID-19 pandemic, we can reduce their risk of morbidity, mortality, hospitalizations, et cetera, by taking the person who is obese and has met the criteria, has gone through your program, and has done well with it.
Correct. COVID-19 is just one-time event. Hopefully with the vaccine, the numbers will drop and we'll have less impact. But this really puts awareness on the fact that if you have an obese society, you really have risks for new diseases that show up, and the problem with the bad outcomes associated with it. It should be a wake-up call in our country that we really need to make our country healthier. We need better food choices, better ability of selling products to patients that aren't high in calories, high in fat calories, high in salt, and really enforce that we need to have a healthier country, which will really, if you think about lowering the cost of healthcare, that's the key. Is if you can live a healthier lifestyle, your overall health that you're going to have is going to be better, and you're not going to spend all those dollars treating all these diseases. So one thing that can come out of this COVID pandemic for a positive is the realization that you can't be a fat society and be a healthy society.
So let's bring in Sandra as the coordinator of the bariatric program. It's not just the surgery, it's the pre and the post. Do you want to tell the viewers a little bit about the program itself?
Yes. So here at RWJ Somerset, we have a complete bariatric and metabolic program. We offer surgical weight loss as well as non-surgical weight loss options. We have registered dietitians that are specially trained to work with our patients who have issues with their weight. They work with them, teaching them how to meal plan, count calories. We have exercise programs here as well. So we have a complete program. The non-surgical weight loss piece is an excellent piece because there are some people who do not qualify per their BMI. They may not have the comorbidities that are quote unquote required by the insurance companies in order to undergo weight loss surgery. So the non-surgical piece is a great tool. It's also a tool to assist our patients in losing weight before undergoing the weight loss surgery, which helps the surgeons greatly. So it is a complete program where our patients are coming in. They have support in terms of psychological evaluations. They're coming in, they're having that behavioral portion addressed, because this is not something that happens overnight. It's something that, happens over time. So we want to make sure that our patients are continue to be supportive even after they've undergone their surgery, because we want our patients to be successful. So it's critical that we have that behavioral piece as well as the nutrition piece. And of course, following up with the surgeon.
Well, again, the nice thing that you and Dr. Ward have put together is this complete program. When I've sent patients to you, you do first a whole metabolic workup on them. You have them seen by a psychologist to ensure that, one, that they're thinking correctly, that they're not doing this on the spur of a moment. You're sending them over to the pulmonary people to make sure there's no sleep apnea, to make sure that the people are taken well care of. If there's any kind of questions, you're sending them to the cardiologist. You're giving them a good dietitian, nutritionist follow-up, and you're trying to make sure that you're following all of the correct protocols so that their insurance can cover it if it's deemed appropriate. And then even more important is the post-operative period, where the people come to you, and I've had people come to you a year later, et cetera, to follow up with the dietitian, nutritionist. And by doing what you do post-operatively, you continue to allow the person to achieve the weight loss and can keep the weight off of them.
Yes, that's correct.
So it's the collaboration between you and Dr. Ward that makes this actually work.
Yes. It is a multidisciplinary effort.
I like that word, multidisciplinary. Mm-hmm. Okay, so trying to lose weight during this pandemic, of course, is difficult for most people. What are your suggestions for people who are thinking about trying to lose weight?
So first thing we do is when patients come to see us is, even on the first visit, when they see me, they see a nutritionist. I try to get an idea of how the patients are eating, how many calories they're taking in. Our main goal is to have them develop a plan for success. So even after the surgery, if they don't follow a plan, they're not going to be successful long term. When you have surgery, you take on risk. It's a big commitment. So 5 years after surgery, if you're back to the weight you were before, we don't find that, that's very disappointing to us as well as the patient, to the referral doctors. So we try to educate our patients on how to eat healthy for a lifetime. We don't call it dieting. We just call it like a total change of how you view food. So first thing we always do is have them count their calories for a few weeks the way they're eating now, see where they are, try to reduce their calories, better choices. And then every month they're following up with myself and the nutritionist. They're keeping food logs, they're understanding where their calories are coming from. And each person eats differently. So we've learned that if I give you a diet and it's my diet, you don't like the food I like, you're not going to follow the diet very long and you're not going to succeed. So the first thing we do is make a list of all the foods the patients like, and then we look at the calories and the protein involved in those foods. So if you're a high carb eater eating lots of bread, pasta, rice, you're not getting a lot of protein, get a lot of extra calories. Right away we say, look, you can have some rice, but you have to know that 1 ounce of rice is like 115 calories. You can't take a whole box of rice, stick it in the pot, and then decide you're only going to eat 1 ounce, because you tend to eat 6 ounces, 10 ounces. And before you know it, you have 1,000 calories on your plate for dinner just of rice. So immediately, my little, speech to patients is, if you have a goal, you have to have a plan if you want to be successful. Just like a teacher, if the teacher taught the children from any chapter in the book and just kept going from chapter to chapter, the children would fail. Same thing as our patients. If they don't have a plan, they're going to fail. So the most successful patients develop that plan with myself, Sandy, the nutritionist. And even before their surgery, they lose weight. And that's the key, get that running start. So most insurance companies require months of preoperative evaluations. And in that period, the most successful patients already lost weight before they even have surgery. So getting their blood pressure under control, their sugars under control, losing weight ahead of time is a good predictor of success afterwards. So you can almost tell who's going to be like that patient who 5 years, 10 years is going to be successful on how they follow the program before they even have the surgery. And since our program allows patients to follow up indefinitely, that once again, those patients who do better before, they do better during surgery, they even follow up more. And so long term, you'll find you can almost, like I said, I can predict every patient who's going to be 5 years down the road a successful patient because they've really have that commitment. They're tired of feeling crappy. And so all of a sudden they're like, wow, I feel so much better even before the surgery. And then they go through the surgery more successful, and then they have a more positive attitude afterwards. So our program with the psychologist, nutritionist, Sandy, all in one office really helps patients.
Very nice. And the different types of weight loss surgery that you do?
So today there's two main procedures, laparoscopic sleeve gastrectomy and laparoscopic gastric bypass. We do more sleeve gastrectomies just because long-term there's less risks, less complications, but occasionally we do bypass still on patients with really bad diabetics. All these surgeries reduce the amount of food you can eat, and all of them have some metabolic effect that helps with the hormone levels. These hunger hormones that normally go up when you diet, those go down with these surgeries. So even though you're eating a lot less calories, you don't have that constant hunger that you develop when you're dieting and cutting calories, drastically. And that helps patients for the first year really get a head start. Rather than constantly thinking of food and being hungry while they're losing weight, they really don't care about food. And that, that's the key. That first year is the most important time where people redevelop, they develop their own habits, get rid of the bad habits, get new habits. And that's where we support them. They see us multiple times in that post-op period. They're probably seeing us 5-6 times post-op in that first year, and that really helps them be successful.
And are there potential risks?
With the gastric sleeve, the risks are all up front. So at the time of surgery, we make sure that they don't have any bleeding complications, any leaks from any staple lines. We put everybody on a blood thinner for 10 days after surgery, make sure they don't get any blood clots. But long-term with a sleeve, they really just take vitamins. The long-term risks are very low. With gastric bypass, we have to follow their vitamin levels because you can have vitamin issues with gastric bypass, but most of the risks are all the time of surgery. So when you're going home, their risk of having surgical complications are very, very low. And that's why, you've noticed your patients, they really have good outcomes. We say the risk of this surgery now is almost the same risk as getting your gallbladder out. So we've really done a good job. And
again, the steps that a patient needs to do in order to get into your program are?
So to get your surgery, every insurance company has different criteria, but it really breaks down to you have to see the nutritionist anywhere from usually 4 visits once a month to 6 visits. They have to see a psychologist. Most of the time it's 1 to 2 visits. They get a note from you, the primary care, making sure they're qualified for the surgery, that their medical problems are under control. If they have sleep apnea, they're cleared by the pulmonologist. If they have a history of heart disease, they get cleared by the cardiologist. They all get upper endoscopies to make sure there's no issues with the stomach before we operate on them. And then we send that all to their insurance company, and then they get approved. So we're pretty good about getting people approved. They follow the program. So from the person who shows up day one, most of the time they're having their surgery anywhere from 4 to 6 months afterwards. And during that period, we always try to have them lose weight. And like I said, the more successful you are at losing weight during the first period, the more successful you're going to be after the surgery.
And after the surgery, what do you expect afterwards?
The weight loss the first month is usually 8 to 10% of your body weight. So if someone's 250 pounds, they lose 20, 25 pounds the first month. They're at about 9 months, they probably lost about 80% of their weight loss that they're going to lose. So if someone's 100 pounds overweight and they're really doing well, they might lose 80 pounds by 9 months. And then over the next 9 months, they'll lose the last 20. Because obviously when you're smaller, you use less energy to move yourself. So you can't just keep losing at the same rate, otherwise you disappear. So what ends up happening is the first 9 months is the most rapid weight loss, and then it flattens out. Those who exercise more and feel better get to their goal weight faster. But usually at 1.5 years afterwards, that's where they're going to be in terms of their weight. The way we determine if you're really successful is about 50% of excess body weight that remains off over 5 years, we consider that a success. So if someone keeps 50 pounds off and they're 100 pounds overweight, you wouldn't think that's success, but it really does make a huge difference on the comorbidities. So some people will get down to ideal body weight, but that's not everybody. But about 70-80% of the people will get down that 50% of their excess body weight.
And Sandy, the post-operative support. What does the bariatric surgery program do for the people post-surgery as support?
Post-operatively, I am following up with every patient that comes through here to have weight loss surgery. So they're receiving a call from me. They have my information. They can contact me if any problems or any questions come up and that they want to discuss. Our patients are following up with their surgeons at clearly stated intervals. They're given all of that information pre-surgery time. We also have support groups here at the hospital, which we offer on a monthly basis. So we do encourage everyone to come back and attend those. They are free of charge. They just have to show up. And we encourage the participation. Again, this is not something that happens overnight. So it does take a while to, incorporate all of these steps in this new lifestyle that they now have in order to be successful. So we do encourage them to come back for the support.
Well, what's really important is prior to Dr. Ward, we really did not have a bariatric surgery program at Robert Wood Johnson University Hospital, Somerset. And Dr. Ward, with you, have put together this intensive, comprehensive program, which is a necessity for obesity, diabetes, and especially in this COVID-19 pandemic with people putting weight on, we actually have something that can combat that.
Yes, I mean, the most important thing is access, right, in healthcare. And Robert Wood Johnson's definitely made a commitment to access because we take all the insurance plans, we take Medicaid plans. So I would say that almost everybody out there who has insurance, whether it's, Medicare, Medicaid, private insurance, has access. And that's something, that Robert Wood Johnson can be proud of. So the majority of people who show up can get surgery, where before that happened, it was very difficult if you had Medicaid to get access. And also it was very difficult to get psychologists because it was all very divided up. Now the patients have a place they can see the psychologist. It's covered by their insurance. The nutritionist is covered by their insurance. So, no matter how you talk about it, if you don't have access to healthcare, you can be obese and have problems. But if you can't get the care, it doesn't do you any good. So I'm proud that Robert Wood Johnson Physicians Enterprise made that commitment and made it, a program that many patients in our community can access. And it's really, been a success in terms of allowing patients, from a wide range of areas to come to the Bridgewater area and get care.
Well, it's not only Medicaid, but 2 or 3 years ago, many private insurance companies really threw a stop into the ability of patients to be able to get bariatric surgery. And through this comprehensive program that you have put together with Sandra, you've been able to break those barriers. You've been able to accomplish things that were unaccomplishable prior to all of this, and being done in a local community hospital where the people also have local support by their own families rather than having to travel all over the country to have this done. And that the leadership at Robert Wood Johnson University Hospital, Somerset, along with your leadership, gave the ability and access for people to have this important procedure to be able to be done.
It definitely, I mean, I give Tony Cava, the CEO of the hospital, credit. I mean, he definitely was, went out there and he got the resources. Without the resources, you can't get everything together. It takes money to get all the different components together, and that Robert Wood Johnson made that commitment, and it's been successful. The amount of surgeries have been going up steadily, even with the pandemic and the closures. We still, have a lot of patients that are getting surgery and have access. We use both telemedicine, as you do, as well as office visits. We we try to make it as convenient for patients as possible. So obviously they have to be seen a few times, but they can do a lot of their visits through telehealth. They talk to myself, they talk to nutritionists. The psychology visits are all done through DocsMe, which is a telehealth system. And that also makes it more convenient for the patients. They don't have to come in during the pandemic, makes it safer. So we've done as much as we can, keeping access open and keeping patients, seeing the visits so they're not losing time, even during the whole pandemic.
And the fact that at Robert Wood Johnson University Hospital, Somerset, we're following guidelines to keep the virus under control so that when they do come in for surgery, when they do need to come in to see you, to see someone, and the post-operative care, that they don't have to worry about the environment that they're in.
Correct. I mean, they all have private rooms. They stay overnight one night for the surgery. Every patient that we've done during this entire period nobody has catched any COVID from their stay. They're all tested beforehand. Everybody, universal precautions. So when patients ask me, is it safe? I said, look, it's as safe as going to Home Depot as going to the hospital. So, we haven't had any issues with people catching anything during their surgery. In fact, like I said, I tell my patients having the surgery is the best thing you can do to prevent yourself having problems, because you're more likely to catch the virus outside of our system. And if you're obese and you have all these problems, you're going to have more risk of having a bad outcome than after you start losing weight.
So, Sandra, do you want to leave any important messages for the studio audience, but as we're getting ready to finish this program, what they should know, who they should contact?
Sure. So if this is something that you're struggling with, something that you're thinking about, we do urge you to please call us. You can contact me directly. My telephone number here, my direct line is 908-685-2200. My extension is 6293. You can speak to me directly. No information is shared. It's a private call. I'll answer any questions that you have. If you need any reassurances, I'm here to provide that for you. And again, this is an excellent tool. We have great services here. Again, it's a multidisciplinary approach. It's a team effort, and we're here to help you. So if this is something that you're interested in, please contact the surgeon, contact me. We're here for you. So we just want you to get healthy and stay healthy.
And Dr. Ward, any last words that you want to talk about the bariatric center itself, or about obesity, or about the link of COVID, respiratory illnesses, and how people can protect themselves?
Even during the COVID pandemic, and now there's a lot of people sick, we're still open. You can make an appointment through telehealth. You don't have to even come in the office if you're worried about the pandemic. Because the process takes a while. So the sooner you start, the sooner you'll have the surgery. Most people starting now, by the time they have their surgery, the vaccine will be out, for months. So hopefully the pandemic will be winding down. Like I said, even after this is all over, losing weight's a really important component to a healthy lifestyle, reducing all your health issues. I always say, like with Robert Wood Johnson, the way we developed this system, you can't get any cheaper, you can't get more access, you can't get your surgery anywhere else as more affordable than you can with Robert Wood Johnson. We've developed a system that makes it so that you have the least amount of visits to get your requirements done and the least amount of cost. And I know in this time when there's economic problems, people are worried about that the system has done a great job in not only making access to all different patients with different insurance, but also keeping the cost down. So, I get that question very often, like, how much is it going to cost me? And I said, there's nothing better than knowing you can't get any cheaper and more quality than you can at Robert Wood Johnson, Somerset. So we're proud to offer a comprehensive program that's affordable, that gives great health care, that, has a long-term commitment. And it's, like you say, local right here in our office in Bridgewater, New Jersey, basically 5 minutes from the hospital.
Thank you both for being here, and thank you for everything that you do for the bariatric surgery program itself, as well as for Robert Wood Johnson University Hospital, Somerset. I congratulate both of you on taking a program and really making a real terrific quality program.
Thank you very much.
Thank you for having us.
This concludes today's episode of Robert Wood Johnson University Hospital Somerset's Health Talk. Please remember that the opinions expressed here by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call our physician referral number at 888-724-7123. For more information about Robert Wood Johnson University Hospital Somerset's Bariatric Surgery Program, please visit our website at www.rwjbh.org/Somerset.